In 7th grade, we watched a movie on an open heart procedure, and I thought it was really fascinating. I went home and broke out the encyclopedia and learned about the blood flow through the heart, learned all the names of the valves, and from then on I was hooked. I knew that that's what I wanted to do. Entering into medical school, I knew that I wanted to be a heart surgeon. I found a lot of aspects of what I studied really interesting, but doing my clinical rotations, it was really the heart that captured my interest and made me go into cardiothoracic surgery. Cardiothoracic surgery is operating on any of the major organs that fall from beneath the neckline to just above the diaphragm, and including the diaphragm. It involves anything from trauma to removal of tumors, both in the lungs, the esophagus, as well as in the heart itself, which also is an area of interest of mine. It also involves the typical things that you'd think of, like surgery on the blood vessels of the heart, the coronary arteries, or of the valves, which can be done nowadays either through an open incision, a small incision, or actually through the veins and arteries in the legs, as well as other parts of the body. It's a really dynamic time for cardiothoracic surgeons. We continue to innovate. We continue to try to get patients back on their feet faster and back to doing the things that they love. Well, I think it's really great to meet somebody in what has to be one of the most trying or even the worst moments of their life and get to know both the patient and the family throughout that process and be able to see them recover and go back to the things that they were doing before this. I love the idea of a place that is the best place to give and receive care. I think it speaks volumes about the type of effort that's put forth to make sure that the providers and the patients are both exceptionally well taken care of. It's an exciting concept.